What needs to happen before the government actually heeds the now desperate calls of healthcare workers who have simply been asking for protection as they put their lives on the line to save our fellow countrymen and women from the coronavirus? The calls, it appears, are still falling on deaf ears as more doctors and nurses die of COVID-19. Helen Aura attended the memorial service of one more fallen hero.
Tears flowed and hearts broke as colleagues and loved ones gathered to mourn and celebrate yet another life taken by the deadly coronavirus. Senior physician and senior medical superintendent at the Thika Level 5 hospital, Dr. Jacqueline Njoroge, is now among the 30 healthcare workers who have succumbed to COVID-19. While the medical fraternity are trying to hold strong, they say they're being weakened by an unsupportive government.
Some of the conditions within which our health workers got sick and they didn't get medical care. A doctor, one of the plastic surgeons who actually died because they couldn't get an ICU bed. It is quite devastating that the care that you give, you cannot receive it.
Over 2,000 doctors have tested positive for COVID-19 countrywide. Health workers are urging the government to shift their priorities away from politics and focus their efforts and funding on the pandemic and the health sector.
It is disheartening to seriously ignore the frontline workers. PPEs are lying somewhere in Kemsa when doctors are dying. Don't think doctors are sick upstairs to call for a strike.
Months into the pandemic and doctors are still pushing for comprehensive health cover that would cushion them during the current and future pandemics. They also want a health service commission to be constitutionalized to help address their concerns. Helen Aura, NTV.